Chronic pain has become the biggest health issue in America today. 100 million Americans, 1.5 billion people worldwide suffer from chronic pain. Not only is it the leading cause of disability in the U.S., but it costs us a whopping $500 to $635 billion every year. I'm here with Dr. Nasar Shahid, a physiatrist and pain management specialist who has his own unique approach to this issue. Welcome, Dr. Shahid.
Thank you for having me.
Tell us a little bit about your background and your experience and how it's shaped your perception of how we should handle pain management in the U.S.
Well, after my medical graduation, I joined New York Presbyterian Hospital, which is a university hospital for Cornell and Columbia universities in physical medicine and rehabilitation. And after completing my residency program, I went to Hawaii for my fellowship, which was in interventional pain management and sports medicine. And my first job after fellowship was as an assistant professor at New York Presbyterian Hospital and Columbia University, where also I worked as director of Spine Center as an interventionalist. And then from there, I went to King Fahd Medical City, where I was chairman of Rehabilitation Hospital.
Wow, you've been everywhere. Columbia, NYU, Cornell, you've got quite a few degrees to your name.
I think what I learned mainly was from my patients. Because, these institutions, they give us protocols, guidelines, and discipline. But really, when the patient comes to us with the same diseases, what we learn from our professors and our books, that's a whole new thing, a human dimension of those diseases. So that enriches our experience.
That's wonderful. Now, you've likened treating patients to a spiritual experience. Can you explain that?
Yes, treating chronic pain patients particularly is a spiritual experience. Because, in all spiritual systems, if you look around the world, in different cultures, there are common ingredients. For example, interacting with humans compassionately, you will find in all spiritual systems. Similarly, being in the moment with your conscious effort, that you're consciously aware of what is happening in that moment. That is also common to all spiritual systems. And the third thing, very interesting, is that there is a distance between what is going on in your mind and the moment. You go beyond logic and reasoning. What we hear in the books, what we read the science, all those things are reasoning and logics. But when you're dealing with the humans, sometimes the logic and reasonings, you have to go beyond that. And that's why I think dealing with our patients with chronic pain is actually a spiritual experience.
What are some of the top myths people who've diagnosed themselves on the internet have come in to you with?
Yes, myths about chronic pain especially are quite common. And yes, one big reason is the people are getting their information without any proper discipline from the internet. However, some myths are because of the human weaknesses. For example, normally people would think that if something is very expensive, a technique which is very expensive, more money is spent, that would be more effective. Well, that's not true. Sometimes a small modification in their life, a little change, will alleviate or will at least minimize or manage their pain. Similarly, some people think if the setting is very nice, you go to an institution, everybody is like very well mannered, there are high-tech things going on. So those techniques, those modalities, those settings will be more useful for them. That's why people go from one institution to other institutions and they come and say, "Doc, I went everywhere, I did everything, I'm still in pain." Similarly, some people, they have the myth that surgery is something big. And if they had surgery, all their pain are going to go away. Well, after the surgery, after the lumbar fusion, after so many cutting, they come back to me and they say, "Doc, I'm still in pain." So not necessarily that surgery is good for everyone, only a minority of patients would need that. So, but that myth remains in people that if something is simple, it may not be effective, but something is very high-tech and surgical, that will be more effective. Similarly, one big myth I see in people is, most of the time, the responsibility is kind of put on or diverted to somebody else. Like, the healthcare insurance carrier, the other people who have been treating them, the family members, even the government. So there is, when someone puts their responsibility or diverts their responsibility to others, they lose a very important quality that is the center of their treatment, taking their own responsibility. That doesn't mean they should blame themselves. That only means that they develop that ability to respond to the situation in which they are. And once they are conscious of that, everything else becomes easy. Every prescription or a suggestion or recommendation by the healthcare provider actually becomes more effective.